Cherry lips are all the rage in Korea right now, and Dr. Ordon is in our procedure room with board-certified plastic surgeon, Dr. Deepak Dugar, showing us how to get that cherry lip look. What's going on back there, docs?
So cherry lips are basically a trend right now in Korea because it's a sensual, kind of sexy way to do lips right now. There's been a trend recently where lips have been overdone, and you see the edges of the lips being turned up, and it looks kind of fake, almost duck-like. And so we're pulling it back to the more conservative version by focusing on the medial aspects.
I think that's what we hear more in the office than anything else when we're starting those lips. I don't want to look quack-quack like a duck.
Yeah, that's
so
right.
So you have a lovely patient here today. We have Alexa, and what are you trying to achieve?
I think I just want my lips a little bit bigger. You know, I've always noticed that they were a little small, so I just want them just a little bit bigger.
Well, you're in great hands. Should we get started?
Yeah, absolutely. So the cool thing about the filler that I want to use today, theirs is the newest expression technology, and the reason I love this filler from Restalyn is because the filler itself is really sticky, and if you look at it, it kind of clumps and sticks, and it doesn't really move once you place it. So it ends up being a really nice, soft, supple look inside the lips. So we're gonna show you what it looks like when we put it inside her actual lips now. So what we do in the cherry lips is we really focus on the medial aspects of the lip versus focusing on the lateral aspects where normal lip injections sometimes are done. And we just want to plump up the body of the lip in the medial aspect to give it a little bit more of a volume where we call kind of the Cupid's bow area. And so by giving that little bit of volume right in the center, you're able to give it a little bit of an accentuation without it looking too overdone and without making the lateral aspect too curled out. And we do the same thing on the bottom lip as well, where we're focusing on the two medial angle aspects. So you're kind of looking like two small cherries, where you're just accentuating the balls and the medial aspects of the lip to give a little bit more volume. So it looks just a little bit more like the supple version of the same lip.
And I think that's the key with lips. Less is more, and start off slowly. You can always come back and get more. How do you get that ducky look where when you try to put too much in at one time and focus more on the outer parts and the central part? I like it, Doc.
Thank you. So we're just doing this last central compartment on this left side of her lower lip. And again, we're focusing on the center part. So it's almost like two cherries, two on the top, two on the bottom, just to give a little softness to the lips without overdoing it or having it look like anything was done.
So that's it?
That's almost it. We're about to give you a peek.
Wow.
And Dr. Dugar, there is lidocaine, right? There's anesthetic in the filler that you're using that makes it a little more comfortable.
Yeah, this
correct?
Restalyn filler has lidocaine inside the syringe itself. So as you inject, it also numbs the lips a little bit. But on top of that, we did use some topical numbing on her lips for about 20 minutes before, so she doesn't feel that much right now.
So you've been comfortable, Alexa?
And for our viewers, how much is this going to cost and how long will it last?
This will last anywhere between 6 to 12 months on general, depending on the type of filler used. There's thicker substances that will last a little bit longer, and then thinner substances will last a little bit shorter. But 6 to 12 months, and this will cost anywhere between $500 to $1,500, depending where you're getting it done. So we give everyone a peek of what we did today? All right.
Alexa, are you excited to see your results?
I am.
Can you sit up for us, Alexa? There you go. All right, let's take a look at Alexa before. And let's take a look at Alexa now after she's gotten her cherry lips.
Nice.
You guys have a mirror back there so she can see it?
Yeah, let's hand her one.
I like this because it's not overdone. I think it's so easy with filler to try to fill the sides there, which isn't physiologic. That's not how your lip is supposed to go. It's supposed to taper like this. So I think this is a nice subtle enhancement.
Oh, it looks so good.
Well, and I think you both, Doc, said it perfectly, which is a little can go a long way. Thank you so much, Dr. Dugar, for sharing this with us. Alexa, we hope you're happy.